This particular Arkstone OneChoice report is analyzing an NGS urine specimen. Let's review each part of this report in detail. When you look at a OneChoice report, the first thing you're going to see is an infection complexity ARC score pretty much in the center of the page. And what that is doing is telling the provider the level of complexity of the infection at hand. And this is important because when it comes to treating infections, the complexity of the infection itself can determine what antibiotics are available to treat and what antibiotics are not. So if you have a very complex infection, which may have a lot of resistant genes or a lot of microbes detected, which may be difficult to treat just because of intrinsic resistance, what you're left with is less choices for the possible treatment of that infection. And that creates difficulties. So we want the providers to understand that not all infections are created equal and that there is a diversity and range of what we might be dealing with. When you see a low infection complexity score of 1, 2, or 3, then you get in a situation where you might have more choices available to you, and that's going to be reflected in the OneChoice recommendation. On the contrary, when you see the numbers are in red, 5, 6, or 7, you'll see that the choices we recommend may be more complex, or there may be an antibiotic that may have more adverse drug reactions associated with it. And we have no choice. We have to recommend it because there aren't options available based on what we're detecting and the resistant genes and the other factors we're taking into consideration. So the infection complexity ARC score is an important tool for a provider to look at a quick glance to understand what are they dealing with. Do they need to ask for extra help? Do they need to get an infectious disease specialist? Can they treat this on their own? Is it going to be an antibiotic that it's something they're familiar with? Is it going to be an antibiotic that they routinely use or something that's newer that is only available to treat very resistant organisms? So underneath the infection complexity ARC score is your OneChoice. And your OneChoice is that preferred regimen that's going to treat the microbes we're targeting. That is that one antibiotic that has the least propensity to cause resistance, the more narrow spectrum antibiotic, and the antibiotic that's going to treat all the microbes with just one antibiotic as opposed to multiple antibiotics. That's the OneChoice. We believe that's the antibiotic that's going to be best, that's going to translate to the least adverse effects when using. If OneChoice is not appropriate for the patient for whatever reason, perhaps the patient had a bad reaction to that, perhaps there's something in the patient's history that will prevent you from using what Arkstone is recommending as the preferred antibiotic, then you have alternative treatment options in the paragraph right below. Assigned to each antibiotic in this alternative treatment option is the adverse drug reaction ARC score. You can see the number right next to the antibiotic. And these are alternative options that could be used, but for some reason were not selected in the OneChoice. And that could be a variety of reasons, as we just mentioned before. But these are alternatives. These can work as well. If you look at the adverse drug reaction ARC score, just to get into that, you'll see that on the left side of the page, the OneChoice recommendation has an adverse reaction ARC score that's assigned to it. And in this case, we're seeing trimethoprim sulfamethiazole, which is an antibiotic that was assigned a score of 1, which means it has a better safety profile and it is the best antibiotic regarding the adverse effects to the patient. If you look at the other antibiotics recommended in the alternative treatment paragraph, you'll see that their ARC scores are higher, like nitrofurantoin has an ARC score of 3, or Cipro has an ARC score of 5, and this is attributed to the adverse drug reactions or the side effects that could be attributed to these antibiotics. We have an algorithm we put in place in order to determine whether an antibiotic would be better or worse regarding its effect to the patient. And this includes FDA warnings. It includes whether or not there can be an adverse effect to a patient's certain organ systems in a patient, whether or not there needs to be special drug monitoring, lab work that needs to be associated with the antibiotic. So we put a lot of thought and we put a lot of evidence behind why we would recommend one antibiotic over the other. So say, for example, an antibiotic like ciprofloxacin has an FDA warning. That's going to automatically make that antibiotic have a higher adverse drug reaction ARC score, which is telling the provider that this drug that has worse associated adverse outcomes than using something like Bactrim or something like nitrofurantoin or fosfomycin. Sometimes in the OneChoice, we would recommend an antibiotic that is easier to access or is more commonly found in pharmacies because we believe that's also important when it comes to prescribing as well. So providers have sometimes never heard of an antibiotic, or it's very expensive, or it's hard to obtain. And we factor it in the OneChoice as well. We want to put that antibiotic there that's not only safer, but also something that's obtainable. So I'm just going to shift over to the left side of the page here just to go through that before I continue down the paragraphs in the center. The OneChoice is targeting the organisms in bold. And the reason for that is that those are the most common pathogens that are likely contributing to the infection. The organisms that are not in bold are not being targeted because those are microbes that are commonly found as contaminants or colonizers or normal flora. So this is all in an effort of our antimicrobial stewardship program. We want to make sure that we're not indiscriminately treating things. We want to treat the most likely cause for the infection. And in this case, it's Klebsiella aeruginosus. And that is the organism that we're targeting, and that's what's most likely causing this infection. The next thing you'll see on the left side of the page is resistance detected. And that is, in this case, we're seeing that aminoglycosides and methicillin are resistant genes that have been detected. And again, the OneChoice factors this in. So when we recommend an antibiotic, it will be able to work in the presence of these resistant genes. There is an antimicrobial resistant ARC score that is assigned to the collective resistance that is found. And the higher the score, again, the more implications that resistance have. So if you have a score of 7, what that indicates is that the resistance has a significant impact on the usability of antibiotics. If the ARC score has a low number, like a 1 or a 2, that means that, lucky for us in this scenario, the resistance is not a significant contributor to what antibiotics can be used. Next, we'll have allergies reported, and if labs have this part on their requisition form, we can factor in different types of allergies that are reported by the physician, and that will be also a factor in our recommendations. So we will prescribe an antibiotic that works in the presence of those allergies. So here we see that we provide some basic information regarding how to dose and make modifications. The dosing on the OneChoice is standard dosing, but these antibiotics do need to be adjusted for the patient's particular clinical scenario. And in this case, renal adjustment is recommended, which means that it has to be adjusted for the patient's kidney function. Sometimes a drug will need to be adjusted for the patient's liver capabilities or liver functions, and that's hepatic adjustments. And you'll see on this part of the page, the physician can look at this and see what adjustments need to be made based on the patient's history and lab work. We also list some common side effects and some common drug interactions that will be useful for the provider when using this medication. Now, shifting back over to the center of the page, after you see the alternative treatments, we have several other paragraphs which give key points and key educational information to the provider on when these types of infections need to be treated, what types of special considerations are there, how long should treatment last, depending on what the provider may be treating. So, for example, if the provider is not treating a urinary tract infection and treating something more complex like pyelonephritis, we have information pertaining to that as well. And the last part of the page is infection control measures. We basically put in place so that facilities like nursing homes, rehab facilities will understand and know what to do when they receive a organism with certain resistant genes, or when we detect certain organisms that require special type of infection control measures.